Okay, thank you very much. Merci. Good morning, good afternoon. As we all know, vaccination is one of the world's greatest public health achievements. For over 50 years, vaccines have provided a cost-effective tool to help control and eliminate the spread of deadly diseases in Canada and abroad. Canada's vaccination programs and regulatory approval systems are among the best in the world and the envy of many. We have well-established systems to deliver vaccines to Canadians and need only to look to the rollout of seasonal influenza vaccines, measles and polio vaccines to understand how Canadians will benefit from leveraging and building on our existing infrastructure in a future COVID-19 vaccine campaign rollout, recognizing some of the unique aspects related to COVID-19. We're doing everything we can to give Canadians access to the safest, most effective COVID-19 vaccines in the world. Over the past several months, there has been a great deal of preparation taking place behind the scenes to ensure Canada is well positioned to obtain COVID-19 vaccines and, building on our well-established systems, provide access to every Canadian who wants one in 2021. This is the first in a series of regular weekly briefings on Canada's vaccine plan. Today's focus will be on procurement and Canada's regulatory process to approve vaccines for the Canadian marketplace. Future briefings will cover topics such as logistics, distribution, and allocation. Vaccine development is a highly complex and long process that typically takes years due to the extensive research required to ensure a safe and effective product for human use. COVID-19 vaccine efforts are taking advantage of the latest innovations and unprecedented global collaboration to accelerate the development of a COVID-19 vaccine. As of November 12, 2020, there are over 140 COVID-19 candidate vaccines in different stages of development by academia and industry globally, with 104 vaccines in clinical trials, including 75 vaccines in Phase 1 and/or 2, and 28 vaccines in Phase 3. Phase 3 clinical trials, which are designed to measure how well a vaccine will prevent COVID-19, have been registered in the UK, the US, Brazil, South Africa, Pakistan, Russia, and the UAE. As of October 25, 2020, the Government of Canada has secured access to 7 leading vaccine candidates, which my colleague, Ms. Reza from Public Services and Procurement Canada, will speak to. The development of a diverse portfolio of promising candidate technologies informed by expert advice from the Vaccine Task Force will mitigate the risk of vaccines failing to reach market. Of the 7 vaccine candidates with whom Canada has established agreements, 5 of these developers are in Phase 3, 1 is in Phase 2/3, and 1 is in Stage 1/2. The Government of Canada is working closely with the provinces and territories and our many public health partners to ensure there is a timely, fair, and well-coordinated rollout once 1 or more vaccines have been authorized for use by Health Canada. Dr. Sharma will be speaking in more detail to the regulatory process in Canada. As things stand now, we expect certain vaccines to become available in early 2021. However, it's important to note that the initial supply of these vaccines will be limited. In the meantime, the Government of Canada, provinces and territories, and other partners are working together to identify high-priority groups who will benefit the most from these vaccines. The National Advisory Committee on Immunization, or NACI, is an external advisory body that provides the Public Health Agency of Canada with independent, ongoing, and timely medical, scientific, and public health advice in response to questions from the Public Health Agency of Canada relating to immunization. On November 3rd, NACI released its preliminary guidance on key populations for early COVID-19 vaccination, outlining a recommended targeted vaccination program. NACI's preliminary guidance outlines a targeted vaccination program that achieves public health goals as efficiently, effectively, and equitably as possible when vaccine supply is limited. Their recommendations will inform government decision-making around first vaccines once Canada has access to safe and effective COVID-19 vaccines, and will continue to evolve and be refined as further data and information become available. The key populations that NACI identified include those at high risk of severe illness and death from COVID-19, including advanced age and other high-risk conditions, those most likely to transmit COVID-19 to those at high risk of severe illness and death from COVID-19, and workers essential to maintaining the COVID-19 response, such as healthcare workers and caregivers in long-term care facilities. those contributing to the maintenance of other essential services for the functioning of society, such as police and firefighters. Those living or working conditions that put them at elevated risk of infection and where infection could have disproportionate consequences, including Indigenous communities. We're also actively engaging with national Indigenous organizations to discuss the appropriate and respectful rollout in their communities. While the initial supply will be limited, I want to be clear that we will have sufficient vaccines such that every Canadian has the opportunity to be immunized. In a country as geographically large as ours, we can expect some logistical challenges ahead. To help anticipate and address any potential challenges, the Public Health Agency is working with the Canadian Armed Forces, whose personnel have been integral to our COVID-19 response since the onset of this pandemic. In addition, the National Emergency Strategic Stockpile, which has sites located across the country, has already acquired and begun to share with the provinces and territories necessary supplies such as millions of needles, syringes, and alcohol swabs, as well as freezers for vaccine storage. We also have a pre-positioning mechanism at our disposal, which would allow us to import and store a promising vaccine in Canadian facilities prior to their market authorization in Canada. This would facilitate faster distribution of the vaccine to provinces and territories immediately upon approval. Until there's a safe, effective, and fully approved vaccine or vaccines which are widely available here in Canada, I want to remind all Canadians that we must continue to practice public health measures, including physical distancing, hand washing, and wearing a mask. With winter upon us, it's imperative that we strengthen our collective resolve and do everything within our individual capacity to safely navigate the weeks and months ahead as we wait for vaccines to become available. Through this pandemic, Canadians have come together to protect those most at risk, and we know everyone will continue to understand the need to protect our priority groups. Canadians will have each other's backs. Protecting the most vulnerable helps protect everyone. Our COVID-19 immunization response cannot be effective without the support and collaboration of our provinces, territories, Indigenous leaders, experts, manufacturers, and all Canadians. Our plan is rooted in core principles, which include science-driven decision-making, transparency, coherence and adaptability, fairness and equity, public involvement, and consistent reporting. Our goal is to enable as many Canadians as possible to be immunized as quickly as possible against COVID-19. While Canada's immunization response is large and multifaceted, we are in a strong position to take on this challenge. When a vaccine is ready, Canada will be ready. Thank you. Maintenant en français. Bonjour à toutes
And
et
now
à tous.
in French, good morning to everyone.
Comme nous le savons tous, la
As we all know,
vaccination est l'une des plus grandes
vaccination is one
réalisations au
of the
monde
world's
sur le plan de la
greatest
santé
public
publique.
health achievements.
Depuis plus de 50
For over
ans,
50
les
years,
vaccins
vaccines
constituent un
have
outil
provided a
rentable pour aider
cost-effective
à
tool
contrôler
to
et à
help control
éliminer la
and eliminate the
propagation des
spread
maladies
of deadly
mortelles au
diseases
Canada
in
et à
Canada
l'étranger.
and abroad.
Les programmes de
Canada's
vaccination et les
vaccination
systèmes
programs
d'approbation
and regulatory
réglementaires du
approval
Canada
systems
figurent
are
parmi les
among the
meilleurs au
best
monde
in the world,
et font
and
l'envie
they are the
de
envy
nombreux pays.
of many
Nous
countries.
disposons de systèmes bien
We
établis
have
pour
well-established
distribuer des
systems
vaccins
to
aux
deliver
Canadiens.
vaccines to
Il suffit
Canadians,
de se
and
pencher
we need
sur le
only to
déploiement
look
des
to the
vaccins contre la
rollout
grippe
of seasonal
saisonnière,
influenza
la rougeole et la
vaccines, measles,
poliomyélite
and
pour
polio
comprendre à quel point les
vaccines
Canadiens
to understand how
bénéficieront
Canadians
de la
will
mise à
benefit
profit de
from
notre
leveraging and
infrastructure
building on our
existante
existing
lors d'une
infrastructure
future
in
campagne
a
de
future
vaccination contre la
COVID-19
COVID-19.
vaccine
Compte tenu
campaign
de
rollout,
certains aspects uniques
recognizing
liés
some
à
of the
cette
unique
maladie.
aspects related
Nous
to
mettons tout en
COVID.
œuvre pour
We're
offrir aux
doing everything
Canadiens
we
un
can
accès aux
to
vaccins
give
contre la
Canadians
COVID-19
access to the
qui sont les
safest,
plus
most
sûrs et les
effective
plus efficaces au
COVID-19
monde.
vaccines
Au
in the
cours des
world.
derniers mois,
Over
des
the past
travaux
several
majeurs de
months, there has
préparation
been a great
ont été
deal
menés
of
en coulisses
preparation
pour faire en
taking
sorte que
place
le
behind the
Canada
scenes
soit
to
bien
ensure
placé
that
pour
Canada is
obtenir
well
des vaccins
positioned to
contre la
obtain
COVID-19.
COVID-19
Et
vaccines
misons sur ces
and
systèmes bien
building
établis
on our
pour vacciner
well-established
tous les
systems
Canadiens qui
provide
souhaiteront
access to
d'être
every
en
Canadian who wants
2021.
one in
La
2021.
présentation d'aujourd'hui est la
This
première
is the
d'une
first
série
in a
de séances
series of
d'information
regular weekly
hebdomadaires sur le
briefings
plan du Canada
on
en
Canada's
matière de
vaccine
vaccination.
plan.
Nous nous concentrons aujourd'hui
Today's
sur
focus
l'approvisionnement et le
will be on
processus
procurement
réglementaire du
and
Canada
Canada's
pour
regulatory
l'approbation des
process to
vaccins
approve
destinés au
vaccines
marché
for the
canadien.
Canadian
Les prochaines
marketplace.
séances d'information
Future
porteront
briefings
notamment
will
sur la
cover
logistique,
topics
la
such as
distribution
logistics,
et l'attribution.
distribution, and
La mise
allocation.
au point des vaccins est une longue
Vaccine
processus très
development is a
complexe
highly
qui
complex and
s'échelonne
long process
habituellement sur
that
plusieurs années
typically
compte
takes
tenu des
years
travaux de
due
recherche
to the extensive
approfondis
research
nécessaires
required
pour
to
garantir un
ensure a
produit sûr
safe
et
and
efficace
effective
pour les humains.
product for human
Pour la
use.
vaccination contre la COVID-19,
COVID-19
on tire
vaccine
profit des
efforts
dernières
are
innovations
taking
et d'une
advantage of the
collaboration
latest
sans
innovations
précédent
and
à l'échelle mondiale
unprecedented
pour
global
accélérer la mise
collaboration
au point de
to
vaccins.
accelerate the development
En
of a
date du 12
COVID-19
novembre
vaccine.
2020,
As of
il y avait
November the
plus de
12th,
140
2020,
candidats
there are
vaccins
over
contre la
140
COVID-19
COVID-19
à
candidate
différents stades de mise
vaccines
en point
in different
par le
stages
milieu
of development by
universitaire et
academia
l'industrie dans le monde.
and industry
De ce
globally,
nombre, 104
with
vaccins
104
faisaient l'objet d'essais cliniques.
vaccines in
Ça veut dire
clinical
75 vaccins en
trials.
phase
That
1
means
ou 2
75
et
vaccines in
28
phase 1
vaccins en phase 3.
and or 2 and
Des essais
28 vaccines
cliniques
in phase
de
3.
phase 3 qui servent
Phase
à
3
évaluer l'efficacité
clinical
d'un
trials,
vaccin
which
à
are designed
prévenir
to
la
measure how
COVID-19,
well a
ont été
vaccine will prevent
enregistrés au
COVID-19,
Royaume-Uni, aux
have been registered
États-Unis,
in the UK,
au
the
Brésil,
US,
en
Brazil,
Afrique
South
du
Africa,
Sud, au Pakistan, en
Pakistan,
Russie et aux
Russia,
Émirats arabes
and the
unis.
United
En
Arab
date du
Emirates.
25 octobre
As of October the
2020,
25th,
le Canada
2020,
s'était
the
assuré
government of
l'accès à
Canada
7 des
has secured
principaux candidats
access
vaccins,
to
ce
7
dont
leading
parlera mon
vaccine
collègue, Madame
candidates,
Reza, de
which my
Services
colleague
publics
Ms.
et
Reza from
Approvisionnement
Public Services
Canada.
and Procurement
La
Canada will
création
speak
d'un
to.
portefeuille
The
diversifié de
development of a
technologies
diverse
candidates
portfolio of promising
prometteuses,
candidate
guidées par les
technologies
conseils d'experts du groupe
informed
de
by
travail sur les
expert
vaccins,
advice from the
permettra
Vaccine Task
d'atténuer
Force
le risque
will
que des
mitigate
vaccins
the
ne
risk
soient pas
of
mis au
vaccines
marché.
failing to reach
Des 7
market.
candidats vaccins pour
Of the
lesquels
7
le Canada
vaccine
conclut
candidates with whom
des ententes,
Canada has
5
established
vaccins
agreements,
en sont à la phase
5
3,
of these
un
developers
vaccin
are in phase 3,
en est aux phases 2 et
one
3
is in
et un
phase
vaccin en est aux
2/3,
phases 1
and
et
one
2.
is in stage
Le gouvernement du
1/2.
Canada travaille
The
en
government of
étroite
Canada is
collaboration
working
avec les
closely with
provinces,
the
les
provinces,
territoires et ses nombreux
territories,
partenaires
and
en
our many
santé
public
publique
health
pour
partners
garantir une
to ensure
distribution
that there is a
équitable,
timely,
coordonnée
fair,
et rapide
and
une fois que Santé
well-coordinated
Canada
rollout
aura
once
autorisé
one or more
l'utilisation
vaccines
d'un
have been
ou de plusieurs
authorized
vaccins.
for use
Le
by
Dr
Health
Berthiaume
Canada.
présentera en détail
Dr.
le
Berthiaume will
processus
be
réglementaire
speaking in more
du
detail
Canada.
to the regulatory process
Dans
in
l'état
Canada.
actuel des choses,
As
nous
things
nous
stand
attendons
now,
à ce
we
que
expect
certains
certain
vaccins soient
vaccines to
disponibles au
become
début
available
de
in early
2021.
2021.
Toutefois, il est important de
However,
souligner
it's
que le stock
important to
initial
note
de ces
that the
vaccins
initial
sera
supply of these
limité.
vaccines will be limited.
Entre-temps, le gouvernement
In
du
the
Canada,
meantime,
les
the government
provinces
of
et les
Canada,
territoires,
provinces
ainsi
and
que d'autres
territories,
partenaires
and also other
collaborent pour
partners
déterminer
are
les
working
groupes
together
les plus
to identify
prioritaires qui
high priority
bénéficieront de
groups
plus de ces
who will
vaccins.
benefit the most from
Le
these
Comité
vaccines.
consultatif
The
national de
National Advisory
l'immunisation
Committee on
est un organe
Immunization
consultatif
is an
externe
external
qui offre à
advisory
l'Agence de
body
la santé
that
publique du
provides
Canada
the
de
Public Health
façon
Agency
constante
of
et
Canada
rapide des
with
conseils
independent,
médicaux,
ongoing, and
scientifiques
timely
et de santé
medical,
publique
scientific,
sur les
and
questions
public health advice
d'immunisation.
in response to
Le 3
questions from
novembre,
PHAC
le
relating to
Comité
immunization.
consultatif
On
national
November
de
the 3rd,
l'immunisation
the
a publié ses lignes
NACI
directrices
released its
préliminaires
preliminary
sur les
guidance on
populations
key
clés à
populations
vacciner en
for early
priorité contre la
COVID-19
COVID-19, dans
vaccination,
lequel il a décrit un programme
outlining
de
a
vaccination
recommended
ciblé.
targeted vaccination
Dans ses lignes
program.
directrices préliminaires,
NACI's
le
preliminary
Comité consultatif
guidance
national de l'immunisation décrit un programme de
outlines a
vaccination ciblé
targeted
qui permet
vaccination
d'atteindre
program
les
that achieves
objectifs de
public
santé
health goals
publique de manière aussi
as
efficiente,
efficiently,
efficace et
effectively,
équitable
and
que possible
equitably
dans un
as
contexte où les stocks de
possible
vaccins
when
sont limités.
vaccine supply
Ces
is
recommandations
limited.
guideront les
Their
décisions du
recommendations will
gouvernement
inform
au sujet
government
des premiers
decision-making
vaccins
around
lorsque le
first
Canada
vaccines
aurait accès à
once
des
Canada
produits
has
sûrs et
access to
efficaces
safe and
contre la
effective
COVID-19
COVID-19
et elles
vaccines
continueront
and will
d'évoluer
continue
et
to
d'être
evolve and be
peaufinées au fur et à
refined
mesure
as
que des
further
données et des
data
renseignements
and
deviennent accessibles.
information become available.
Parmi les segments clés
The key
identifiés
populations
par le
that
comité, il y
the
a les
Advisory Committee on
personnes
Immunization has
susceptibles de
identified
contracter une
include
grave
those at
maladie
high
ou
risk
de
of
mourir
severe
si elles
illness
contractent la
or
COVID-19,
death from
y compris les
COVID-19,
personnes d'un âge
including
avancé ou qui
advanced
souffrent d'autres
age
conditions
and
graves.
other high-risk
Deuxièmement, les
conditions.
personnes les plus
Secondly,
susceptibles de
those most
transmettre
likely
la
to transmit
COVID-19 aux
COVID-19
personnes
to
qui
those
présentent un
at
risque
high
élevé de
risk
tomber gravement
of
malades
severe
ou de mourir de la
illness
COVID-19
or death from
et les travailleurs
COVID-19,
essentiels
as
au
well as
maintien de
workers essential
l'intervention
to
pour
maintaining
lutter
the
contre la COVID-19.
COVID-19 response.
Les personnes qui contribuent
au
Also,
maintien
those
d'autres
contributing to the
services
maintenance
essentiels,
of other
au
essential
fonctionnement de la
services for the
société,
functioning of
comme les
society,
policiers et les
such as
pompiers.
police and
Les personnes
firefighters.
dont les conditions de vie
Also,
ou de
those
travail
whose living or working
augmentent le risque
conditions put them
d'infection
at an
et
elevated
pour que
risk of
l'infection
infection,
pourrait avoir
and
des
where
conséquences
infection could have
disproportionnées, y
disproportionate
compris les membres
consequences,
des communautés
including
autochtones.
members of
Nous
indigenous
consultons
communities.
aussi
We're
activement les
also actively
organisations
engaging with
autochtones
national
nationales pour
indigenous
discuter de la
organizations
façon
to
appropriée
discuss
et
the
respectueuse
appropriate
de lancer la
and
campagne de
respectful
vaccination dans
rollout
leur
of the
communauté.
vaccination campaign in their
Même si les stocks
communities.
initiaux seront
While the
limités,
initial
je
supplies
veux
will be
être clair.
limited, I
Il y
want
aura
to be clear
suffisamment de
that we will
vaccins pour
have
que
sufficient
chaque Canadien
vaccines
puisse
such
être
that every
immunisé.
Canadian has the
Dans un
opportunity
pays
to be
aussi grand que le
immunized.
nôtre,
In a country as
nous pouvons
geographically
nous
large as
attendre
ours,
à ce
we
qu'il
can
y ait
expect
certains obstacles
some
logistiques devant nous.
logistical challenges ahead.
Pour nous aider à prévoir
To
et à
help
surmonter tout
anticipate and
obstacle
address
possible,
any
l'Agence de
potential
la santé
challenges,
publique du
the
Canada
Public Health
travaille
Agency of
avec les
Canada
forces
is
armées
working with the
canadiennes dont le
Canadian Armed
personnel a joué
Forces,
un
whose
rôle
personnel
essentiel
have
dans la
been
lutte contre la
integral to our
COVID-19 depuis
COVID-19
le début
response
de la
since
pandémie.
the onset of
En
this
outre, la
pandemic.
Réserve nationale
In addition,
stratégique
the
d'urgence,
National
qui a des
Emergency
installations
Strategic
dans tout le pays,
Stockpile,
s'est
which has
déjà
sites
procuré
located
le
across the
matériel
country, has
nécessaire
already
comme des
acquired
millions d'aiguilles, de
necessary
seringues et des
supplies such as
tampons
millions of
imbibés
needles,
d'alcool,
syringes, and
ainsi que des
alcohol swabs,
congélateurs pour
as
le
well
stockage
as
des vaccins,
freezers
et a
for
commencé à le
vaccine
partager
storage,
avec
and
les
has started
provinces
to
et
share
les
this with the
territoires.
provinces
Nous
and territories.
disposons aussi
We
d'un
also
mécanisme de
have
mise en
a
place préalable
pre-positioning
qui nous
mechanism
permettra
at our
d'importer,
disposal, which will allow
d'entreposer
us
un
to
vaccin
import and
prometteur
store a
dans
promising
des
vaccine
installations
in
canadiennes avant que sa
Canadian
mise en marché
facilities
au pays
prior
soit
to their
approuvée,
market
ce qui
authorization in
facilitera
Canada.
une
This would
distribution
facilitate
rapide du
faster
vaccin
distribution
aux
of the
provinces
vaccine
et aux
to
territoires
provinces and
immédiatement
territories
après
immediately
l'approbation.
upon approval.
Jusqu'à ce que des vaccins sûrs,
Until there's
efficaces et
safe,
entièrement
effective, and
homologués
fully
soient
approved
largement
vaccines which are
disponibles ici
widely
au
available
Canada,
here in
je veux
Canada,
rappeler à la
I want to
population que nous
remind
devons
the whole
continuer de
population that we must
respecter
continue
les mesures de
to
santé
practice
publique, y
public health
compris
measures,
l'éloignement physique, le
including physical
lavage des mains
distancing,
et le
hand
port du
washing,
masque.
and wearing a mask.
Comme l'hiver est à nos portes,
With
il est
winter
impératif
upon
que
us,
nous
it's
réaffirmions
imperative that we
notre
strengthen our
détermination et
collective
que nous fassions
resolve
tout ce qui est
and do
en notre
everything
pouvoir
within our individual
individuellement pour
capacity
franchir en
to
toute
safely
sûreté les semaines
navigate
et
the
les
weeks
mois à venir
and
tandis
months
que nous
ahead
attendons que les
as we
vaccins
wait
soient
for
disponibles.
vaccines to become
Tout au long
available.
de la pandémie, les
Throughout this
Canadiens ont
pandemic,
uni leurs
Canadians
forces pour
have come
protéger les
together
personnes les
to
plus
protect those
vulnérables
most
et
at
nous
risk,
savons que chacun
and we know
continuera
everyone will
à
continue
comprendre
to
la
understand the
nécessité
need
de
to
protéger les
protect
groupes
our priority
prioritaires.
groups.
Les Canadiens seront
Canadians will
solidaires.
have each
En
other's
protégeant
backs.
les gens les plus
Protecting the
vulnérables,
most
c'est à la
vulnerable
protection de tous
helps
que nous
to
contribuons.
protect everyone.
Notre programme
Our
d'immunisation contre la
COVID-19
COVID-19 ne
immunization
peut être
response
efficace
cannot
sans
be
le soutien
effective
et la
without the
collaboration
support
des
and
provinces,
collaboration of
des
our
territoires,
provinces,
des
territories,
dirigeants autochtones,
Indigenous
des
leaders,
experts, des
experts,
fabricants et de toute la
manufacturers,
population
and
canadienne.
all Canadians.
Notre plan
Our
s'appuie sur des
plan
principes
is rooted in
fondamentaux,
core
incluant
principles,
la prise de
including
décision fondée sur la science,
science-driven
la
decision-making,
transparence, la
transparency,
cohérence et
coherence and adaptability,
l'équité et la
fairness and
justice,
equity,
la participation du public
public
et le
involvement,
signalement
and
systématique.
consistent
Notre
reporting.
objectif est de faire
Our
en
goal
sorte
is to
qu'autant
enable
des Canadiens
that as
que
many
possible
Canadians
puissent
as
être
possible
immunisés aussi
may be
rapidement que
immunized
possible
as
contre
quickly as
la
possible
COVID-19.
against
Même si la
COVID-19.
campagne
While
d'immunisation du
Canada's
Canada est
immunization
vaste et
response
complexe,
is
nous sommes
large
bien
and
placés pour
multifaceted,
relever
we are
ce
in a
défi.
strong position to take on
Lorsqu'un
this
vaccin sera
challenge.
prêt,
When a
le
vaccine
Canada
is
le
ready,
sera aussi.
Canada will
Merci.
be ready. Thank you.
We'll now turn over to Ariane Reza. Miss Reza, over to you.
Merci. Bonjour et merci. Ici,
Thank you. Good morning.
l'approche du Canada sur la
Canada's
question de vaccins a été et continue
approach
d'être délibérée,
is
stratégique
continuing
et
to
globale.
be deliberate and strategic.
L'objectif est de garantir
And I'm afraid the
l'accès à un
sound is
portefeuille
not
diversifié de
acceptable
vaccins,
for
de
interpretation.
sorte que le Canada soit bien placé lorsqu'un vaccin sûr et efficace sera prêt. Le Canada choisit ses vaccins sur les recommandations du groupe de travail sur les vaccins contre la COVID-19, qui est composé d'éminents spécialistes canadiens en matière de vaccins et d'immunologie et de chasse de fil de l'industrie, qui prodigue des conseils d'ordre scientifique et technique au gouvernement sur les principaux candidats vaccins. Au nom de l'Agence de santé publique du Canada, Services publics et approvisionnement Canada, l'acheteur central du gouvernement, a négocié des ententes avec 7 fabricants de candidats vaccins de premier plan contre la COVID-19. Notre portefeuille de candidats vaccins comprend des plateformes technologiques nouvelles et inédites ainsi que des technologies traditionnelles, autrement dit, une combinaison de techniques de pointe et de techniques éprouvées en matière de vaccins. Ces fabricants sont AstraZeneca, Sanofi et GlaxoSmithKline, Novavax, Johnson & Johnson, Pfizer, Medicago et Moderna. Afin d'avancer aussi rapidement que possible, la majorité de nos ententes ont débuté en tant qu'ententes de principe, conçues pour garantir un certain nombre de doses pendant les négociations des ententes d'approvisionnement anticipées. À ce jour, nous avons conclu des ententes définitives avec 5 des 7 fabricants et les négociations pour la mise en place d'ententes définitives avec Johnson & Johnson et Novavax vont bon train et sont sur le point d'aboutir. Au total, ces 7 ententes donnent au Canada l'accès à 194 millions de doses. Ces ententes donnent également au Canada la possibilité d'acheter jusqu'à 220 millions de doses supplémentaires. Cela signifie que nous avons la possibilité d'accéder à un total allant jusqu'à 414 millions de doses. Ainsi, le Canada dispose de la flexibilité nécessaire pour prendre des décisions futures quant à l'exercice de ces options. Bien entendu, tout candidat vaccin doit recevoir l'autorisation de Santé Canada avant de pouvoir être administré aux Canadiens et Canadiennes. Et mon collègue, la Dr Sharma, en parlera plus en détail un peu plus tard. Services publics et approvisionnement Canada est en train de surveiller les calendriers de livraison et nous négocions en permanence avec les fabricants de vaccins afin d'obtenir des doses de vaccins le plus tôt possible pour la population canadienne. J'insiste sur le fait que ces calendriers varieront selon les candidats vaccins et dépendant entièrement de la progression des essais cliniques de la société, des résultats et des demandes ultérieures d'approbation réglementaire. Quoi qu'il en soit, les premières livraisons de vaccins contre la COVID-19 devraient commencer dans le premier trimestre de 2021. Parallèlement, nous travaillons d'arrache-pied pour garantir que les éléments essentiels nécessaires à l'administration efficace et rapide des vaccins, tels que les aiguilles, les seringues et les congélateurs, soient disponibles afin que le Canada soit prêt à agir dès que les fabricants expédieront les vaccins. Par exemple, le Canada a commencé à acheter des aiguilles et des seringues au cours de l'été. Nous en avons maintenant assez pour administrer près de 25 millions de doses de vaccins, sans compter les stocks supplémentaires qui arrivent chaque mois. Services publics et approvisionnement Canada fait également l'acquisition, au nom de l'Agence de la santé publique du Canada, des services d'un fournisseur de soutien logistique pour appuyer la distribution de vaccins aux Canadiens et Canadiennes. Cela comprend des éléments tels que le transport et le stockage. Dans le cadre d'une invitation à se qualifier concurrentielle, le Canada a sélectionné 4 fournisseurs qui pourraient répondre à ces exigences. Et nous soumettons maintenant les travaux à leurs concurrents. Nous avons pour objectif de mettre en place un ou plusieurs contrats en décembre. En plus de ce travail à la demande de l'Agence de la santé publique du Canada, nous avons également acheté 26 congélateurs pouvant fonctionner à moins 80 degrés Celsius et 100 congélateurs pouvant fonctionner à moins 20 degrés Celsius. Et ce, pour stocker les vaccins. Le premier envoi de 34 congélateurs, dont quelques-uns de chaque type, a été déjà livré à l'Agence de la santé publique. Nous lancerons également une demande de proposition pour des congélateurs supplémentaires d'ici la fin de la semaine. Enfin, nous avons récemment publié une demande d'offre à commande pour de la glace sèche afin de soutenir la distribution et le stockage des doses de vaccins dans tout le pays. Cet appel d'offres se termine lundi et nous allons agir rapidement pour conclure des attentes. Pour terminer, Je tiens à dire que le Service public et approvisionnement Canada continuera d'aider l'Agence de la santé publique du Canada à garantir l'accès aux vaccins et à veiller à ce que le Canada ait la capacité de stocker, de fournir et d'administrer ces vaccins. And now in English. Hello, and thank you for being here. Canada's approach to vaccine acquisition has been and continues to be deliberate, strategic, and comprehensive. The target is to ensure early access to a diverse portfolio of vaccines so that Canada is well positioned to receive doses as safe and effective vaccines are ready. Canada's vaccine selection is guided by the COVID-19 Vaccine Task Force, which is composed of leading Canadian vaccine and immunology experts and industry leaders providing scientific and technical advice to the government on major vaccine candidates. On behalf of the Public Health Agency of Canada, Public Services and Procurement Canada, the government's central purchaser, has negotiated agreements with the manufacturers of 7 promising COVID-19 vaccine candidates. Our portfolio of vaccine candidates includes new novel technology platforms as well as traditional tech. In other words, a combination of cutting-edge and tried-and-true vaccine science. They are AstraZeneca, Sanofi and GlaxoSmithKline, Novavax, Johnson & Johnson, Pfizer, Medicago, and Moderna. In order to progress as quickly as possible, most of our agreements began as agreements in principle, which enabled us to secure doses from vaccine suppliers while the details were being negotiated for the final advance purchase agreements. To date, we've reached final agreement with 5 of the 7, and negotiations towards final agreements with Johnson & Johnson and Novavax are progressing well and are being concluded. Altogether, these 7 agreements give Canada access to 194 million doses. These agreements also provide Canada with options to purchase up to 220 million additional doses. This means that we have the potential to access up to 414 million doses. This provides Canada with flexibility to make future decisions about whether to exercise options. Of course, any vaccine candidate must first receive Health Canada authorization before it can be administered to Canadians. And my colleague, Dr. Sharma, will speak more to that process a bit later. Public Services and Procurement Canada is continuously monitoring and negotiating delivery schedules with the manufacturers to get vaccine doses as early as possible for Canadians. It is important to underscore that timelines for delivery of doses vary from vaccine candidates and are dependent on the company's clinical trial timelines, results, and subsequent regulatory filings. In terms of timelines, first delivery of COVID-19 vaccines are anticipated to start in the first quarter of 2021. At the same time as we are finalizing these agreements to get Canadians access to safe and effective vaccines as they become available, Public Services and Procurement Canada is working to ensure that access to supply of the critical goods and services needed to deliver efficient and rapid administration, things like needles, syringes, and freezers, are on hand, so Canada is ready to go as soon as manufacturers are ready to ship vaccines. For instance, Canada initiated a procurement over the summer for needles and syringes, and we now have received enough supply to administer nearly 25 million doses of vaccine, with more supply arriving every month. Public Services and Procurement Canada is also procuring on behalf of the Public Health Agency of Canada the services of a logistic provider to support the effective distribution of vaccines to Canadians. This includes elements like transportation and storage. As part of a competitive procurement process, Canada selected 4 suppliers that have the capabilities to meet Canada's requirements, and we are now competing the work amongst them. We're aiming to have 1 or more contracts in place in December. In parallel with this work and at the request of the Public Health Agency, we've also purchased 26 freezers with minus 80 degrees Celsius capability and 100 freezers that can operate at minus 20 degrees Celsius to store vaccines. Our first shipment of 34 freezers, including both types, have already been delivered. We will also be issuing a request for proposals for additional freezers shortly. Finally, we recently launched a competitive procurement process to purchase dry ice to support the distribution and storage of vaccine doses across the country. This tender closes on Monday, and we will move quickly to put it in storage. In closing, Public Services and Procurement Canada will continue to support the Public Health Agency of Canada in securing early access to vaccines and ensuring that Canada has the capability to store, deliver, and administer those vaccines. Thank you.
Thank you, Ms. Reza. We'll turn over to Dr. Supriya Sharma.
Thank you. Thank you, Eric. My name is Supriya Sharma. I'm the Chief Medical Advisor at Health Canada, and I'll be speaking to you about the regulatory process today. We understand that we need to be nimble and agile while maintaining our standards for safety and efficacy and quality. While significant time and resources are being devoted to expediting the scientific review of COVID-19 vaccines, the decision on whether they will be authorized will ultimately depend on assessment of the data, including the complete information from clinical trials, which is still coming in. Health Canada has a rigorous scientific review system in place to ensure vaccines are safe and effective in preventing the disease they target. And we will only authorize a vaccine if its benefits clearly outweigh its risks. Under usual circumstances, Health Canada reviews vaccine submissions after all clinical studies are completed and the full study results are available. That timeline for the full review can take up to a year. However, recognizing the urgent need for COVID-19 health products, like vaccines, the Minister of Health signed an interim order introducing more flexibility to expedite the review and authorization of drugs and vaccines for COVID-19. For example, it allows Health Canada to accept rolling submissions for drugs and vaccines that have promising evidence and clinical trials underway. This means that we will accept and assess the information submitted by the manufacturer as it becomes available. This new process still involves reviewing all the necessary data, but it can shorten the time it takes for a new vaccine to be authorized once all the necessary data are available. Health Canada is conducting independent reviews of the vaccine candidates, with reviewers assessing the data in the context of the Canadian healthcare system. That doesn't mean we're doing it alone. From the moment we knew that vaccines were starting to be developed, we have worked with our international colleagues to align our standards of evidence and discuss the advances being made by the scientific teams working globally. Canada's requirements for vaccine approval under the interim order are comparable to those for an emergency use authorization in the United States and other pathways internationally put into place specifically for assessment of vaccines and treatments for public health emergencies. While developing a vaccine, scientists collect evidence to show that it's safe, effective, and manufactured to the highest quality. This evidence comes from the review of manufacturing processes and human clinical trials. Health Canada's reviewers thoroughly review the submission to confirm that there are no significant safety concerns, and they determine that the vaccine is able to prompt an adequate immune response in vaccinated people and shows that it can protect against disease, as well as determine from the safety and the efficacy review that the benefits outweigh the risks and ensure that the vaccines can be manufactured to high quality standards. They review procedures for safety monitoring outlined by the manufacturer and any plans to minimize any identified risks. We've also dedicated more resources to review COVID-19 submissions. Reviewing a vaccine submission can consist of hundreds of thousands of pages of data, takes on average 2,000 person hours. Each vaccine review typically involves a team of 7 to 12 reviewers, and this is what our reviewers do day in and day out. Once a vaccine is in use, Canada has a vaccine safety monitoring system that involves healthcare professionals, the provinces and territories, the Public Health Agency of Canada, as well as Health Canada. And this is to alert public health authorities of any changing trends or unusual adverse events that weren't previously reported. These alerts trigger expert medical reviews, which are conducted on all serious adverse events to identify any safety concerns. This system is called the post-market surveillance system, and it's essential to ensure the continued quality, safety, and effectiveness of all vaccines that are being used in Canada. As my remarks come to a close, I just want to underscore that while we are working hard to give Canadians access to COVID-19 vaccines as quickly as possible, we will not compromise our safety, efficacy, and quality standards. Protecting the health and safety of Canadians is our top priority. Merci. Thank you.
Thank you, Dr. Sharma. Dr. Bertium, à vous la parole.
Bonjour, mon nom est Marc Bertium.
Good afternoon, I'm Marc Bertium, and I'm the Director of Medical Sciences at Health Canada. We are conscious that we have to be quick and agile, and at the same time we have to maintain our standards in terms of effectiveness, efficiency and safety. A great deal of time and energy is accelerating the scientific examination of vaccines against COVID-19, but at the end of the day, the decision to authorize them or not depends on the assessment of data and the complete results from the clinical studies. that are still coming in. Canada has a system of medical examination which is rigorous to ensure that the vaccines are safe and efficacious to prevent these diseases. We only want to authorize a vaccine if the benefits are outweighing the risks. Normally, Health Canada examines the presentation of vaccines once all of the clinical trials have been finalized and we've got the complete study results that are available. There's a complete examination that can then take up until a year. However, given the urgent need to protect us against COVID-19, the Health Canada has signed an emergency order, which means that there's more flexibility to accelerate the assessment, the approval of the medications and vaccines against COVID-19. And as a result of this emergency decision, Health Canada can accept presentations that are still continuing for drugs and vaccines that have given promising results and which are covered in these clinical trials. That means that we're receiving the information that's coming in from the manufacturer as it becomes available. This new process means that we're still examining all of the necessary data, but it reduces the time of approval for a vaccine once all of the required data is available, and Health Canada carries out independent experimental evaluations, and the assessors evaluate the data within the context of the Health Canada system. That does not mean that we work alone. As soon as we knew that vaccines were starting to be developed, we've worked together with our international colleagues to harmonise our standards on the scientific data and to discuss possible progress that was being made by the scientific teams that were working on a global level, and the criteria for approval for vaccines which we've got in the emergency order are comparable to the emergency orders that apply in the US and other mechanisms that have been developed abroad, in particular for assessing vaccines and emergency treatment because of public health emergency. And when the scientists draw up a vaccine, they gather data to show that it's safe, effective and efficacious, and that it's in line with all of the quality standards and the manufacturing standards and the human clinical trial standards. The assessors in Health Canada examine the submissions to ensure that there are no problems in terms of safety, and also to ensure that the vaccine can have an adequate immune response for those who are vaccinated, and it will actually protect them against the disease. And it's established in the light of looking at the safety and the efficacy and drawing the conclusion that there's more advantages than risks, and also to ensure that the vaccine can be manufactured in accordance with high manufacturing standards. When we're looking at the surveillance measures for safety and also the plans to reduce to a minimum any risks that have been observed. And we have got new resources to examine these submissions, and the examination of a submission which can contain hundreds of thousands of pages in general takes 20,000 person-years, and each assessment normally means 7 to 12 assessors are involved, and that's the work that's being carried out by our assessors day after day. Canada has drawn up a surveillance system for the safety of the vaccines after they're being used, and within this system, the health professionals in the provinces and territories and the Public Health Agency of Canada and Health Canada alert the public health authorities if there's any changes in the trends and if there's any adverse effects that have not yet been reported. And then there are specialists that carry out medical evaluations looking at all these serious adverse effects to identify any problems with safety. The system is called the post-market surveillance system, and that is essential to ensure that we maintain quality, safety and efficacy of all the vaccines that are used in Canada. And to round off, I would like to underline that even if we work around the clock to bring on board a COVID-19 vaccine, there will be no compromises in terms of our safety, efficacy and effectiveness standards. The protection of the health and safety of Canadians remains our #1 priority. Thank you very much.
We will now open the phone line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles.
You can put your questions in any
yourself to one question
the
and
official
only
language.
one follow-up. For those asking questions in the room, we ask that you make your way over to the freestanding mic. Over to you, operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser votre question. La première question, the first question is from Émilie Bergeron of Agence QMI. Please proceed, la parole est à vous.
You have the floor.
Oui, bonjour.
Yes.
Dans vos
Good afternoon.
déclarations d'ouverture, je pense
In
que
your
c'est Dr.
opening
Njoo qui a
statements,
dit
I
que
believe it was Dr. Njoo who said
ça va être possible de
that it would be
recevoir et de
possible
stocker
to
des
receive
doses de
and
vaccins
stock of
au Canada
vaccine
avant
doses
que Santé
in
Canada
Canada
ait
before
donné son feu
Health
vert. Est-ce que
Canada
ça veut dire
has
que, par
given the
exemple, si
green
un
light.
vaccin a été
Does that mean
approuvé
that if a
aux
vaccine
États-Unis
has been
par
approved
FDA,
in the
il va
US
pouvoir
by the
commencer à
FDA,
arriver
can it start
même
to
si l'approbation
arrive
de Santé
here
Canada
even if Health
est toujours en
Canada's
attente?
approval is still being
Oui, merci
awaited?
pour la question.
Yes,
C'est
thank
Dr.
you
Njoo.
for
Oui,
that
c'est
question. It's
exactement
Dr. Njoo
le
here.
cas.
Yes, that's
On
exactly the
a
case.
toujours, comme il dit, la flexibilité
We've
de,
always got the
de
flexibility, as
recevoir
we've
les
said,
vaccins
to
pour
receive
mettre en place. En
vaccines
attendant, c'est l'approbation
while
n'est pas
awaiting
encore,
the approval,
le processus n'est pas encore terminé, mais je vais
even if the
passer la parole
process
à
is
Dr.
not
Berthiaume
fully
pour
finalized.
élaborer
But I'll give the
encore.
floor to Dr.
Certainement.
Berthiaume to continue
Alors,
on
l'arrêté
this.
d'urgence qui a été adopté
So the
par la
emergency
ministre de
order
la
that was
Santé
adopted
permet
by
un
the health
prépositionnement
minister
des
means
vaccins
that
au
we can
Canada. Donc, ça permet,
have a
dans le
preposition
fond,
of vaccines in
d'accepter et
Canada. So
d'importer
that
des
means that we
vaccins au
can
Canada avant qu'ils
accept
soient
import
officialisés,
vaccines in
officiellement
Canada
autorisés.
before they've been
Ce qui permet, en fait,
officially
qu'une fois qu'il y a une
approved. That
autorisation,
means
il puisse
that
avoir
once
une
there is this
distribution
approval,
rapide.
there
Donc,
can
c'est une
be
option qui
rapid
existe
distribution. So
dans
this is an
l'arrêté
option that
d'urgence qui a été
exists in
adopté
this
le mois de
emergency
septembre.
order that was adopted back in
I
September.
can do it in English.
Answer.
So just to say that the provisions that we put in for the interim order allows for something we call pre-positioning. So currently, the way that the laws work is that you can't bring in a product into Canada unless it's authorized. But the interim order will allow companies to import those vaccines prior to Health Canada authorizing them. However, those vaccines would only be distributed and they would go through vaccination when Health Canada has done, after Health Canada has authorized it. Now, it's really only for vaccines for which we have advanced purchase agreements and that are currently under review. And the idea is that if there's anything that would potentially delay the distribution of those vaccines, that we want to avoid that. So we allow them to be brought into Canada ahead of time.
Thank you, Dr. Zemeli. Question suivie?
Follow-up question?
Oui, merci.
Yes, thank you.
Juste pour être clair, c'est à partir de
Just to be
quel
quite
moment
clear,
que
from which point in time
doses-là pourraient
will there be the
se faire?
arrival
Est-ce que
of
c'est
these
nécessairement,
doses?
quand une autre
Will it be
autorisation a été donnée à
when
l'étranger,
another
comme la
approval has
FDA
been
que je
granted
mentionnais,
abroad, for example, with the FDA in the
ça
US?
peut se faire même avant
Or can
ça?
this be done
Et
even
aussi au
before
niveau
approval has
de
been granted in
temps,
another country?
de conservation des
And then when it
vaccins,
comes to the
c'est quoi votre marge de
conservation
manœuvre?
times for the vaccines, what is your margin for
Donc,
maneuver
pour
there?
répondre à votre
So
question,
to answer your
l'arrêté
question,
d'urgence permet
with this
d'avoir, dans le
emergency
fond,
order,
l'importation de vaccins
we
avant
can
leur
import
approbation
vaccines
au
before
Canada
they're
sans qu'il y ait
approved in
un
Canada
lien avec une approbation dans une
without there
autre
being any
jurisdiction. Donc,
link
c'est pas
with
un
approval in
facteur
another
limitant.
jurisdiction. So this is not a
Ceci
restrictive
dit, on
factor.
s'attend à ce
But having
que
said
les
that,
autorisations
we
pour des
imagine
vaccins qui sont
that the
actuellement
authorization
en
of
revue se
approval,
fassent
the
de façon
vaccines that are under
relativement
review,
proches les
will be
unes des
done
autres.
relatively
Donc,
close one to the other.
on prévoit pas de grands
So we
délais
don't think
entre
there's going to be a
l'approbation
big
des
gap
médicaments.
between
Fait que je
the
pense pas que ce soit un
approval
facteur
of the
important en
drug. So I
termes
don't think that's going to be a
limiter
significant
l'accès. Mais
factor
pour
in
ce qui est de
terms of
l'arrêté
limiting
d'urgence, donc
access.
on peut
But when it comes to the
importer ces
interim order, we're
médicaments-là,
able to
même si on
import
pas encore
these
été
drugs
autorisés
even if they have
dans
not
d'autres
yet
pays.
been
Pour
approved
ce qui est
in
de la
other
durée de
countries. When it
conservation,
comes to the
j'ai pas de
conservation
données
time,
spécifiques
I don't have
là-dessus. Je
specific
pense que ça va
data
dépendre
on that. I
spécifiquement des
think
produits.
it
Ce sont
will
des choses
depend
qu'on regarde
specifically on the
actuellement,
products.
évidemment.
We're
Là, on
looking
sait que
into all of this at
les
the moment.
différents vaccins,
We
selon
know
leur
that different
technologie, peuvent
vaccines,
avoir
depending
différentes
their
modalités
technology,
de
will have different
réfrigération. Pour ce qui est de la durée
refrigeration
de
arrangements.
la
When it
conservation,
comes
ça
to
fait
the
partie
conservation time,
des choses que
that
l'on
is part
analyse là,
of what we're actually
lors de la revue.
analyzing during the review
Merci,
process.
docteur. Opérateur, prochaine
Thank you,
question.
Doctor. And now next question, please.
Merci. Thank you. The next question is from Mia Rabson of the Canadian Press. Please proceed. Your line is open.
Yeah, good afternoon. I'm wondering if you could talk a little bit more about what this pre-positioning of vaccines would actually look like and what the shelf life is. And my understanding is that vaccines can't sort of last forever. You can't produce them now and then they'll be around forever. So just wondering if you can talk about the logistics of what this would mean. Would it be all in Ottawa? Would they be sent to the provinces early? Walk me through a little bit more about the details of how that might work.
Sure. So this is Supriya Sharma. I'll start on that. So yeah, you're right. So the pre-positioning allows it to be imported into Canada. There aren't any specific specifications on where those need to be stored, but in general, they would be stored in a central location. Now, when we're looking at the first vaccines that are coming through, likely it would not be they would not be candidates for pre-positioning because it's likely that the authorization by Health Canada and the time that there would be very little time between the authorization and when those vaccines would be ready and have a supply to be brought to Canada. But as we go forward, there may be situations where a company has supply and they have the amounts that they need to send to Canada. And so then that could be sent into Canada. Pending the Health Canada authorization, it would be kept in a central location. And then after the Health Canada authorization, it would then be distributed and then it would be proceeding to vaccination. On the issue of shelf life or expiration dates of the vaccine, that's one of the things that we look at when we do the regulatory review. So companies will provide data on the manufacturing of the vaccines themselves, and that includes how long the shelf life might be. So we're in the process of looking at that data right now, and we don't have those determinations for the 3 candidate vaccines that we're looking at right now at this point in time yet.
It's Dr. Njoo. Maybe I can just add to that. As I indicated in my opening remarks, this really is the first in a series of what we call regular weekly technical briefings, and the focus today is on the procurement, also on the sort of the regulatory approval process. And the question is a good one, but it gets a little bit into logistics and other areas, which I think we'll get into more detail and unpack as we have future briefings. Thank you.
Thank you, doctors. Mia, follow up?
Yeah, we're just trying to get ahead of ourselves, Dr. Njoo. I would also wonder if you could talk to me about the approvals or the finalization of agreements. The Ontario Health Minister said today that she wasn't aware that there were final agreements and that the vaccines might not actually be coming to Ontario as had been previously reported. But I believe I heard today that 5 of the 7 agreements are finalized. So I'm just wondering if someone can talk to what it means to have a final agreement. Is it absolutely guaranteed that those 5 are coming to Canada at some point?
It's Dr. Njoo. I think because you're talking about the sort of agreements and sort of some of the contractual or agreement issues, I'm going to pass it on to my colleague, Ms. Reza.
Thank you for the question. Yes, we actually have 7 agreements with the 7 different vaccine candidates. 5, as I indicated in my remarks, are firm and 2 are being finalized. The agreements are advance purchase order that contractually outlines the number of doses, the notional delivery schedule, and our ability to exercise options. So I think that perhaps the question is mostly at the federal level that Canada does have firm agreements.
Thank you. Operator, next question.
Thank you. Merci. La question suivante est de Madame Hélène Bugetti du
No,
Devoir.
it's Madame Hélène Bugetti from Le Devoir. Yes, good afternoon. I'd like to put a follow-up here. In each of the contracts that's been signed, there is a delivery deadline. So for the 3 most promising vaccines, AstraZeneca, Pfizer, and Moderna, what are the deadlines for the first 3 months in 2021? Can you give us an idea of the first number of doses that are in these contracts the first 3 months of the year? It's Dr. Njoo here. I'm going to give the floor to Madame Reza again to answer. Thank you for that question. I'm afraid it's unintelligible to interpret.
Dans les contrats, on ne peut pas décrire en grand détail. Toutefois, sachez que nous négocions activement chaque jour les calendriers de livraison avec les fournisseurs, tels que vous avez mentionné dans votre question, avec l'intention d'obtenir des doses le plus rapidement possible. Il faut cependant savoir qu'elles soient livrées par lot et que la livraison s'échelonne sur quelques mois, c'est-à-dire dans le premier trimestre de 2021, et que les lots deviennent de plus en plus gros à mesure que la production prend son air d'aller. Merci.
Question suivie?
Oui, alors vous dites qu'on est encore en train de négocier.
You've said that we're still negotiating. So we've got these 3 companies that are the most promising.
Il y a un échéancier.
And is there a set timetable? I think that's the question, the $50 question across the country. And it would be great if you could clear this up for us, please.
Merci encore pour la question. En ce qui concerne les premières livraisons théoriques de doses, il est important de comprendre que les vaccins visés par les 7 accords d'achat anticipé se trouvent tous à des différentes phases d'essais cliniques et de processus d'approbation réglementaire connexes. Alors, à l'instant, ce qu'on trouve dans les accords et les attentes est ce qu'on planifie. Et on travaille d'une façon en étroite collaboration avec les fournisseurs pour prévoyer des livraisons détaillées. Cependant, il y a beaucoup de complexité dans leur chaîne, où ils sont dans leur essai clinique, quand est-ce qu'ils vont soumettre leurs applications pour des règlements. Tout ça donne plus de détails et plus d'informations quand on peut avoir les livraisons.
Merci, Madame Reza. We'll now turn over in the room. First question.
Hi, Marika Walsh with the Globe and Mail. On the pre-positioning, it was my understanding that Minister Anand has previously said that the companies would not be exporting to Canada until Health Canada has approved the vaccine. Are you saying that's not the case, or are you saying Canada is ready, but the companies haven't actually agreed to export the vaccines until Health Canada approves them?
So what we're saying is that there is a provision to allow for pre-positioning. So the legal barriers that are normally there about bringing in a vaccine that's not authorized yet into the country have been removed because we put that into the interim order. So that's the issue. For a vaccine then to be pre-positioned, a company would have to have vaccine, that's the most important thing, would have to have supply, and then sufficient supply that they could send to Canada and then store in a location before it would be distributed, and that would be an advantage. Now, especially when we're talking about the first vaccines that are under review that are the mRNA vaccines, they also have very rigorous storage conditions and the cold chain. So those would likely not be great candidates for pre-positioning because you'd actually have to maintain all of those requirements in those storage facilities as well. So it's unlikely that it will be used for the first vaccines, but as we move forward, there may be companies that have supply that would like to avail themselves of this possibility.
And there seems to be some confusion or questions around what happened between August and now. In the spring and the summer, the government said that the NRC facility that already exists would be available to produce small amounts of doses of vaccines, 250,000 per month by November, with the idea that that would go to the vulnerable populations or populations most in need. So what happened that is now not on the table?
It's Dr. Njoo, maybe I can start too. And when we're talking about the issues or bio manufacturing facilities, I think it's important to note that the first two most promising vaccine candidates, as Dr. Sharma has indicated, it's a novel technology. It's never been done in mRNA, type of technology, and so because of that, there really isn't a manufacturing capacity throughout the world. It's very limited, obviously, just the companies. It could be, but the thing is, you see this is happening in real time. Not to get into the details, you can see that AstraZeneca, I know, put out some news in terms of some promising results, but it just in the last few days, we've now seen that the actual quality or the actual clinical data is being more heavily scrutinized. So I think the lesson, I think, for all of us, I think, is that we need to do our due diligence. You can see things in the press, companies may release sort of preliminary information, but I think where it really counts is the actual data that they actually submit to our regulatory colleagues in terms of having a thorough analysis of the data and then seeing where it goes in terms of the approval process.
Thank you, Doctor. Next question, CTV.
Glenn McGregor, CTV News. Question for Dr. Sharma. The U.S. FDA is expected on December 10th to make a decision about the Pfizer candidate, and I'm wondering where that application is in Canada comparatively, and how quickly do you expect we could get a decision from Health Canada on approval? What is the earliest date that any of these first three candidates could conceivably be approved?
So with respect to the three candidate vaccines that we have under review, Pfizer's one of them. It's the one that's most advanced in the review, and we're actually working very closely with our colleagues in both the US FDA as well as the European Medicines Agency. So we're basically looking at the same data packages. We have very similar authorization pathways that are available for public health emergencies. And the way that the reviews are progressing is that we're expecting to make a final decision on the vaccines around the same time as both the US FDA and the European Medicines Agency. Now that's yeah, I mean, I think it really depends on it's of course, it's all based on the science and the data, but the way that the review is going currently, we're still expecting some data to come in, but we're on track to make decisions in similar timelines.
A question for Ms. Reza from the procurement side. We're wondering what the contracts with these vaccine manufacturers say about delivery once approval is granted. Are there any conditions in there about when and how much of our initial orders have to be delivered within a certain period of time? And we just heard from Dr. Sharma that approval could theoretically come in around the same time as the FDA in mid-December. When would Pfizer, for example, be required to make deliveries under the contract we have with them into Canada?
Thank you for the question. So I think it's important to just take a step back and look at this against the backdrop of immense global demand. Canada's been able to secure a strong portfolio of candidates, and we have worked with each of the vaccine manufacturers to through vaccine engagement to actually secure the most early access doses that we could possibly do that. To your specific question, we've talked to vaccine manufacturers and they assure us that the minute regulatory approval comes through, they will be ready to go quite quickly afterwards. And so we're working on that basis that the supply and the initial shipments will, of course, be ramping up as their supply chains come on, but we don't anticipate any lag time.
It's Dr. Njoo. I apologize. Going back to Ms. Walsh's questions about the biomanufacturing facilities and so on, I neglected, I forgot that we do have colleagues from ICIT online, so I just wanted to give them an opportunity if they would like to expand or give any additional points in response to Ms. Walsh's question.
Well, sure. Thanks. This is Cheryl Grunoweg from ICIT. I think that was well answered. The only other consideration I would add is that building out biomanufacturing capacity is extremely complex, and we are working at incredible speeds, unprecedented in the face of COVID. And so it's a constantly evolving environment, and so they're often shifting sands. And so what we're trying to do is make sure that we continue to press for the best outcomes possible, including those working extremely diligently at the NRC, trying to put in place capacity to help the Canadian COVID response effort.
Thank you. Next question in the room.
Hi there, it's David Cochran with the CBC. Dr. Njoo, I want to pick up on your question where you said that vaccinations could start early in the new year, but supplies will be limited. When you say limited, how limited are you talking? Is it a limit of the 6 million doses number by the end of March that we've heard reported publicly? Like, what percentage of the Canadian population can we anticipate might be vaccinated or start being vaccinated by the end of the first quarter?
Thank you for the question. Yes, exactly. What's obviously the figure that's now out in public is the 6 million doses anticipated if the two most promising vaccine candidates, the ones from Pfizer, Moderna, obviously are approved and are ready, obviously, for shipping and delivery to Canada. So at the present time, yes, if we're looking at 6 million doses, and it's sort of a two-dose schedule, we're looking at a population of about 3 million Canadians being sort of at the beginning to be vaccinated. Further, I know the next question is that, okay, so who would that be? And that's where we get into the recommendations from NACI and so on in terms of what would be the priority groups. And we're having active discussions, obviously, with our counterparts in the provinces and territories, are continuing to consult with the experts in terms of doing it, I would say, in the typical Canadian way. It's all about vulnerable populations, but also trying to be equitable and covering a large country. En français, ok. C'est quoi le... Excuse. Ah oui, c'est sûr. Ah oui, Actuellement, on
For
est
the
en
moment,
train de l'approbation, c'est peut-être
we're
plus
working
avancé pour
on
les deux
approval, which is
vaccins
more
candidats les
advanced
plus
for the
prometteurs, c'est de
most
Pfizer et de
promising
Moderna.
vaccine
Et on
candidates,
attend,
Pfizer and
jusqu'à
Moderna.
date, peut-être qu'on
And
va
up until
recevoir
now,
peut-être 6
we're going
millions de
to
doses des deux
receive
compagnies.
around 6
Si ce
million
sont
doses
approuvés
from
avec
these
6
companies.
millions
And
de
if these
doses,
are approved with 6 million doses,
ça prend 2 doses pour chaque
and it
personne.
takes
Ça
2
veut dire
doses per
qu'on est prêt
person, so
peut-être
that means
vacciner 3
that
millions
we're ready to
Canadiens
vaccine around 3
en
million
recevant les vaccins.
Canadians
C'est sûr
when we receive the
qu'au début,
vaccines.
il
At
faut,
the
il
start,
faut prioriser les
of course,
populations.
we'll have to
On a
give
déjà des
priority to
recommandations
certain
de notre
populations. We've already got
comité
recommendations
consultatif
from our
national
advisory
d'immunisation.
committee on
Je pense
immunization, NACI,
qu'on continue avec nos discussions
and we continue with
avec
our
nos homologues des provinces
discussions
et
with
territoires,
our
aussi
provincial and
des
territorial
experts pour
counterparts,
nous donner
and
les
also with
meilleures
experts
recommandations
to
pour
give us the best
comment il faut
recommendations
vacciner les personnes, parce
as
que c'est un
to
grand pays.
who we should vaccinate first.
des
It's
aspects
a
qu'il faut
vast
considérer.
country. There's lots of different
So
aspects to be
my
considered.
follow-up, Dr. Njoo, is if we're going to have enough for 3 million people to be vaccinated by the end of March, or at least have their first needle, assuming approvals and deliveries go as planned, you've also said that you expect to have the vast majority of Canadians immunized by the end of this year. So does that mean we should anticipate a significant ramp up of vaccination throughout the spring and the summer? I know you don't want to publicly disclose deliveries because of contract sensitivities, but based on what you said about when can you expect the population to get the shot in the arm, should we expect a big ramp up in the spring and the summer and have the majority of the Canadian population done by the start of the next school year?
Well, certainly, when I indicated that earlier, it was an optimistic projection because I think certainly all indications are that the two vaccines from Pfizer, Moderna, the results of their phase 3 clinical trials are looking very good. Obviously, our colleagues at Health Canada will have to look at the data in the Canadian context, and hopefully once that gets approved, we'll get that initial batch. And as we move on throughout the year, we certainly anticipate getting the rest of our doses from those two companies, obviously according to the contracts we have in place at this point, their advanced purchase agreements. What I was also looking at is the fact that we actually have advanced purchase agreements with 7 vaccine candidates in total. And certainly the initial results of trials or what phase they're in are also looking promising. So with, I think, an optimistic eye, we're also anticipating that it won't just be those 2 vaccines at the beginning all throughout the year, but they will be bringing other vaccines, or as you say, online as well as being a part of a suite of vaccines in which we'll be able to offer vaccination to Canadians. So that, I think, is what we're looking towards. And some of those, let's say, later vaccines, if they do become approved and are ready for use in Canada, some of the, I think, initial logistical challenges, which we've discussed earlier about Pfizer, Moderna, wouldn't be the same. They would be more like I would say the traditional vaccines in terms of the cold chain, and certainly with our well-established systems in the provinces and territories for vaccination, I think they would, I think, be able to be rolled out in a much easier fashion.
Little ramp up in Q2 and Q3 is what we should anticipate?
If everything goes according to plan, but to say there's always lots of moving parts, and certainly, as you say, you plan for all contingencies, and we'll certainly will make adjustments as we go along as necessary.
Thank you, Doctor. I will now move back to the phone for another round of question. Operator, over to you.
Thank you. Merci. La prochaine question est de Mélanie Marquis de La Presse. La parole est à vous.
Melanie Marquis from La Presse now, please.
Merci. J'aimerais
Thank you.
parler des
I'd like
congélateurs,
to talk
comprendre un peu
about the
comment
freezers
ça fonctionne.
and understand how this is going to work.
Where
will these freezers be set up? Will there be central freezers close to each big airport? How's it going to work? It's Dr. Njoo here with the answer, and I can give the floor also to my colleague, Madame Reza. But I think it's really a logistics question. As I said at the outset of our session, there are going to be other information briefing sessions, including one targeted at logistics logistics. We've already bought certain freezers and we've had a delivery of certain freezers, several freezers, as we've said. But the details as to where we're going to install these freezers, I think that's something where we can give more details at a later session. Perhaps, Madame Reza, would you like to add something?
Merci. Non, tout à fait. Vous avez raison.
I'm afraid the sound is not sufficient for interpretation.
Seront confiés aux provinces et aux territoires en appui à la distribution du vaccin. Alors, l'Agence de la santé publique va travailler étroitement avec les provinces et territoires pour décider où les congélateurs vont être localisés.
Merci beaucoup. Prochaine question.
Thank you very much. Next question, please.
Suivi par rapport à,
so a follow-up question. Could you break down the process and the number of people who are going to be vaccinated in the first 3 months of 2021? I know that you've talked about 3 million by the end of March. How many in January, February, March? What's the breakdown?
Merci pour la question, c'est Dr. Njoo.
Thank you for that question. The answer here from Dr. Njoo. These are details that we're still discussing with our provincial and territorial counterparts. That's a current issue for us. We can't move ahead too fast because we haven't yet had the approval of the 2 promising vaccine candidates, Pfizer and Moderna. If everything goes well, in terms of approvals, then perhaps we'll be able to receive the 6 million doses from the 2 companies at the start of next year, perhaps in the first 2 months in January and February. But these are details that still need to be discussed with the companies and with our provincial and territorial counterparts. Currently, we cannot give you an exact timetable. There's many details that still need to be discussed with several stakeholders.
Next question.
Thank you.
Thank you. Merci. The next question is from David George Koch of BNN Bloomberg. Please proceed.
Yeah, hi there. Most of my questions have been actually answered already, but I'm just calling for a quick fact check, given the fact that a lot of numbers regarding doses that Canada has secured have been kind of thrown quite a bit. So this 194 million and 220 million additional on option, are those up-to-date figures that the government is releasing today? Like, because I've heard various numbers elsewhere. I'm just trying to fact check that.
Thank you for the questions, Dr. Njoo. I will pass that question on to my colleague, Ms. Reza from procurement.
Yes, thanks for the question. Just to confirm, we have a total of 414 million doses. 196 million of them are firm, with options for the, 194 million are firm, with options to provide 220 million additional doses. That gets us to the total of 414 million doses.
And just to confirm that 194 million number, that's a new figure that you guys are committing to.
Well, the total number is 414 million doses in total. And we just tried to demonstrate what is firm and what is the flexibility for Canada to option up to 220 million additional doses.
Okay. And just my last follow-up question here is, in regards to the whole logistics and shipping and procurement aspect of everything, what would you say has been the most challenging aspect of it? Is it securing the ultra-cold freezers for the 2 mRNA vaccines, or is there additional challenges that you're currently trying to figure out? Like, what is the most challenging thing you're trying to figure out right now?
From a procurement perspective, it's making sure that the requirements of the Public Health Agency and by extension the provinces and territories are well identified and that we have procured all the various moving pieces that we need to ensure the safe and effective vaccine administration of the vaccine so that we're ready to go when that first delivery hits the shores of Canada.
Thank you, Ms. Reza. Operator, next question.
Thank you. The next question is from Alison Martel of Reuters. Please proceed.
Thank you. Dr. Sharma, when and if Health Canada has approved a vaccine that is 90% or more effective, what kind of standards should we expect you to hold subsequent applications to? Is there any point where that 50% efficacy standard that you've communicated might rise?
Sure. So the 50% efficacy standard was something that's referenced in our guidance documents in terms of requirements for vaccine submissions. But again, that's just in guidance. So it allows the companies to put together their development plans. Certainly when we look at vaccine authorization, we really look at them individually. And ultimately, we look at the different packages of data that we look at, and overall, it has to be that the benefits outweigh the risks. And for vaccines, it's really important to remember that they're not like chemotherapy agents that are given to patients with cancer, and so then you accept a certain level of serious adverse reaction, like infections or your hair falling out. These are given to healthy people. So we really are looking at all of that information up front, and that's where the safety data comes in very early in the development process, and then we're looking at the efficacy. So there's really no magic number in terms of efficacy. Certainly we're encouraged by the data that we're seeing in some of the vaccine candidates of 90% and above, but there's no specific target that we would be looking at. We really look at each individual vaccine submission as an independent assessment.
Follow up?
Thanks. I know that when you're evaluating drugs, there's often some comparison to what is already on the market. Is there anything like that for vaccines, or is everything sort of a fresh consideration?
Right. So for the vaccines, because there really isn't something to compare it to currently, we're obviously dealing with COVID-19. It's a new disease. We don't necessarily have treatments or therapies that are standard of care at this point in time. So the studies are really designed to look at the vaccine versus placebo, or somebody not getting the vaccine. So those are the ways that at least the initial studies have been set up.
Thank you. We will turn back to the room. Prochaine question, Juliane.
Next question, Juliane, from Radio Canada. Dr. Njoo, you've talked about this in English, but when you're saying you're hoping that the whole population will be able to be vaccinated at the end, what's the timetable roughly? And there's a great deal of anxiety, of course, amongst the population that will have to wait for several months before they get their vaccine.
Merci pour la question.
Thank you for that question.
Moi, je pense que il faut toujours rester optimiste.
I think we have to always remain optimistic, and with the two promising vaccines from Pfizer and Moderna, if everything goes well with the approvals, we'll be getting the 6 million doses at the beginning of next year, and then we're waiting other doses that we will receive from these two companies. Then we have the 5 other candidates if everything goes well with the other vaccines. With the approval, we'll be able to have a whole range, selection of vaccines. Perhaps that's good news, that the other vaccines will be easier from a logistics point of view. To be easier to vaccinate the population with these other 5 vaccine candidates, because we will not need to keep them in very cold conditions, as is the case with the Pfizer and the Moderna vaccines. I think also for the population that's worried, if we look at the priority populations, and if we can start by vaccinating the priority parts of the population, that will actually protect everyone else. Because if we start by vaccinating the healthcare workers, the nurses, and the doctors, then they will not be so likely to pass on the infection to others. So, in principle, Canadians understand that if we protect the most vulnerable parts of the population and also essential workers, that's going to help everyone. If we're in good health, of course, it's very important to continue with the good public health practices, and the vaccines will arrive for everyone. But at the beginning of the pandemic, we saw that people are not always very rational in a crisis. We saw people rushing off to buy toilet paper. So when it's a question of vaccine and life and death, do you think people are going to just wait patiently on their sofa for their turn to come up? Do you not think there will need to be a big communication and awareness-raising campaign to avoid there being this type of rush? Yes, that's very important. We are doing an awareness-raising campaign. We're developing that to educate everyone It's important to give a great deal of information and be transparent so that we can communicate well with Canadians. But on the other hand, I have a great deal of trust in Canadians. In general, we're patient, we're careful. I think that's part of our national Canadian character. That's my opinion. Of course, there's still a few weaknesses and defects, but in general, we're ready to react and face up to anything that occurs. And if it does occur,
Thank
we will
you.
react accordingly.
We are getting really tight on time, so one question each, no follow-up.
Glenn McGregor from CTV News again. I'm a little confused about the timeline because you've given us some new information here about the likelihood that Health Canada would approve around the same time as the U.S. and Europe. The U.S. Health Secretary has said that he expects to get immunizations within 48 hours of approval by the FDA. So that's December 11th, December 12th. And Ms. Reza said once we've granted approval that she's expecting deliveries very quickly. Why then is everything looking towards January, February, more likely March? Is there a possibility that we could have vaccines approved, ready to go, first immunization starting sometime before the end of the year?
So maybe it's a Priya Sharma. I'll start first and then hand over to Dr. Njoo. So I mean, there's multiple things happening at the same time. So Health Canada, on the regulatory side, we're doing our review. The companies that have already finished their clinical trials are working to do their manufacturing. And the really complicated part of the vaccine manufacturing process is when they're doing that scale up, and they're doing that now. So there's often issues that come up during that scale up time. And then it's the matter of, what their volumes are going to be and which volumes are going to which country. So all of that is being determined as we speak. And I think it's really challenging for anyone, regardless of where they are in the world, to commit to the exact dates, because as we said, all of that's happening at the same time. So we're talking about January in terms of getting our first shipments in. If everything goes well and if it goes smoothly, they might be earlier. If there are hiccups or something else happens in the manufacturing process or the distribution process, it may be a bit later. And that's just why we're having, it's really difficult to kind of pinpoint those dates. And for people that are saying specific dates, I think that's great that they've got the confidence in those numbers. But from what we're seeing, there really are a lot of moving parts. We don't want to set up expectations that we may not be able to meet, but at the same time, we're working flat out across. I mean, we've got obviously Health Canada, FAC, our colleagues in PSPC and ISED all working together. But it also has to be in that environment where the provinces and territories have to be ready to receive those shipments and to go out and do those vaccinations. And those conversations are happening as well. So that's why we're saying, it's looking like we'll get to our regulatory review and our decision, which is a very key point in this whole process, around the same time as the other regulators. And then we're going to have to figure out all of those shipments. If any one country got their full allotment of vaccine all at the same time, they would not be able to distribute that, right? So we're just looking at what we can get in. As Dr. Njoo said, we're looking at the numbers that we'll get in. Initially, get the priority groups vaccinated, and then see what else is coming down the pike, which may be more of these vaccines, which we think, but it also could be other vaccines that come in as well. So that's why it's just complicated to be very specific. But I think in the general timelines of authorizations around December, and then getting their shipments in January and getting those moving in January are sort of the best we have to offer at this point in time.
On that, I just wanted to clarify I understand there's a lot of moving parts, but where the certainty and expectations are, because at Health Committee last week, Ian Stewart said that we have contracts that request the 6 million vaccines by the end of March. So if Health Canada approves the Moderna and Pfizer vaccines, are we guaranteed 6 million doses by the end of March of those two combined? Or is that just the best hope and it could actually be later? Can you just clarify if the 6 million is guaranteed by the end of March or not?
So I'll just talk about the authorization piece, and then I'll turn it over. So in the authorization itself, it really just authorizes the vaccine. And again, with all the caveats of making sure that we are at the authorization, we're talking about our final decision. It doesn't talk in the Health Canada authorization about quantities. It's just, is that vaccine safe? efficacious, high quality? Can we scale it up? Are there quality assurance measures in place? And do the benefits outweigh the risk? So that's that piece. And then I'll turn it over to Dr. Njoo and potentially to colleagues from PSPC on the contracts.
Yeah, thank you. So in terms of the actual, like you say, be it the contracts and actually the delivery of the doses, I'm going to pass it on to my colleague, Ms. Reza, to answer that. And maybe I'll get back to the other point. One of the things that was asked, I think, about, the rollout, when are people going to be vaccinated? People in the U.S. might be vaccinated at a certain point in time. I would say that those details, I think we'll be having obviously additional technical briefings, including logistics. One of the things I will point out now, just for everyone to think about, is that, look at the United States, the geography. Look at the geography of Canada. Look at the months, January, February, March. I don't think I have to tell you what season that is in Canada. And so I think that's something else that's another factor that we need to keep in mind as well. So with that, I'll leave it at that and then pass it on to my colleague, Ms. Reza.
Thank you. As it relates to the doses and the first notional deliveries and what the contracts guarantee and how best to proceed, really, I think that where we're at is that we work every day with the vaccine manufacturers to firm up the delivery schedule. We are focused on, of our portfolio of 7, 3 have had very good success. They're now looking at their regulatory submissions. They're now submitting to regulatory bodies. We've just had lots of discussions around regulatory approval. We continue to negotiate with the vaccine candidates, and we're looking at early Q1 for those deliveries.
Thank you, thank you, Ms. Reza. C'est ce qui met fin à notre briefing technique.
Thank you, and that's the end of our technical briefing for today. Thank you.